let's talk healthcare. Probably a lot of the people in the room work with people every day who are outside the healthcare system. I've got two questions for you, and then I'd ask you to explain something. Number one, do you believe that healthcare is right in the United States? Number two, have you or any of your family ever been without healthcare? And number three, you have said that if elected, that you would work to repeal Obamacare, which we all believe in the room is healthcare reform. So I've got two questions and then an explanation.
Okay, I'll try and get to all three of them, and you tell me if I don't get to the three of them. We live in this amazing country where today, not everyone, but we provide access to a larger percentage of our population than any other westernized country, even those that have nationalized health care. We have better access, shorter waiting periods, all of those things today. We had them before this law was passed. We continue to have them even after this law was passed. As to whether my family ever didn't have health care, my father was out of work for a bit when I was growing up. I couldn't tell you for sure or not, but in my adult life, I've always had that. Frankly, at taxpayers' expense when I was a cadet at West Point, and then had federal health care for myself and my soldiers and their families when I was in the United States Army as well. So actually, I've seen federal health care. And maybe this gets to the final point, maybe this is the core of your question too. I have talked about repealing health care. I would love to see that done. I would love to see us undo what happened this past March, and I'll explain. I've actually been around a policy group that worked on healthcare issues. I've spent time doing that and thinking about it. The core problem we have with our healthcare system, and I have three perspectives. One is a soldier and with my family, so I sought better healthcare. The second would be as a patient with my own medical issues and my family's. And third is as an employer, trying to provide health insurance for 500 employees at Thayer Aerospace and now the folks at Century International. Make no mistake about it, this healthcare system was radically imperfect long before this Patient Affordability and Patient Protection Affordability Act was passed. I don't think it protected patients or did anything for affordability. I think it went backwards. The core problem that we as an employer always faced was cost. And I think you see that throughout the healthcare system. I don't believe the legislation that was passed in March did anything to attack that core problem of cost. Indeed, I think it went the wrong way. I think it will ultimately cause cost to be higher. And when costs increase, someone pays for them. Sometimes it falls on the balance sheet of Wesley or uncompensated care. Sometimes it falls on employers. Sometimes it falls on patients, taxpayers. The incidence of the cost varies, but the core challenge we have to attack is cost. And I don't think I'll translate it slightly differently. I seldom see programs that are federalized have cost reductions in the core value of the service or product that they are providing. And in my view, this law takes us a long ways towards nationalized healthcare. You know, the president said you could all keep your plans, but we've seen already that that's not true. We've seen already that individualized plans for college students are now, insurance companies are walking away from them. They're in a place where they can't offer that service. So you've already seen folks who will lose insurance as a result of this law having been passed, and we're just at the front end. I mean, we literally have not begun to put the deepest, biggest parts of that healthcare law into practice. And we will transition to where we have an enormous number. I think it's almost double the number of Kansans eligible for Medicaid. And if you talk to a state legislator and ask them their biggest headache in terms of funding the Kansas state budget today, it's probably Medicaid. Put it beside education and you've got the two. And so thinking of doubling the Medicaid populations on the backs of the Kansas taxpayers, and all you've done is shift cost. And so I, for that reason, think we need to go back up, make incremental change that begin to get at cost. And I'm probably taking too much time, but this is certainly a core question. There are lots of ways to begin to approach that. There is no silver bullet, and make no mistake about it. I mean, the healthcare premiums at Thayer Aerospace went up nearly every year for 15 years of the two businesses. So there were cost challenges long before this law was passed. But some things like liability reform and some things where you begin to introduce data and information so patients can make more informed and better decisions, have the opportunity to really approach cost reduction. And then we'll do what America's always done. We'll make sure that the least amongst us have access. Today we do that, unfortunately, often in our emergency room. and it's expensive, and it's not the place that we would prefer those folks be treated, and for either themselves or for cost reasons. And so we can do better than that. And I hope that when we do go work towards backing out of the law that we passed this past March, which will, by the way, also destroy a ton of jobs, it'll just make it more expensive to hire people in America, right? And when you do that, bad things happen to working folks here in Kansas. We can begin to attack that cost problem. It's complicated. It's a much longer answer, and I already went on for too long. Anyway, thank you.
Do you think healthcare is a right?
You know, I don't think it's a right that's granted to us by our Constitution. I think it is fundamentally something we will always provide for citizens in America, and for 23 years, we've done it.